muscle, like, do you think you can get to it much? Like, because of the upper trapezius, it's gonna be a little bit tricky. But sometimes, especially when you are putting your patient onto the side like that way, you can relax. Do you feel okay there? And then usually the muscle, like a tendinous muscular junction that you can feel is deep inside here. There's a spine of the the scapula, and then there's a clavicle, right? There's a notch made in between. So then, like you're gonna go in deep side there. So that's where you can actually find the trigger point often, like those area, right? So you can working on actually on the supraspinatus muscle, right? And then like when it comes to the friction, it's gonna be a little bit tricky. Like if you have your patient like this size, like small, so then there is a higher possibility that you can actually assess to the spot where the tendon comes out and attach onto. But other than that, like in guide like this, it's gonna be harder for you to find the spot. So you don't need to even try too hard. But what I would do is that like in a prone position or in a supine position, you're gonna go really close to the greater tubercle area, like there's an acromion, right? And then you're gonna go right below, but more like a little bit of the anterior side, and then you're gonna pretend that, oh, there is some adhesion I found, so I may need to working on a little bit of the maybe skin rolling or like a J stroke. So that's the spot that you're gonna try to do something, right? Really close to the acromion. So acromion is on the top of the shoulder like this way, right? And then the humerus is sitting like this way, right? And then it's not directly side, especially when your patient are in prone position. So then their shoulder is a little bit rolled like this, right? So then where you can find the tendon, it's gonna be nearby around the anterior side of the acromion. So the supine position, you can do that too. You can working on all the muscles and then have them turn over. You're gonna opening up the chest too, right? At the moment, you can go close to that area and then just to say that I find something, so I try to working on it, right? That's what you're gonna do. For the infraspinatus muscle, usually where your patient feel the tendon is, it's gonna be between the muscle belly and then the tendon, right? So you're gonna find that spot. But like sometimes when you're putting your patient into abduction and rotation like this way, so then actually the tendon, it felt better because it's now out from the deltoid muscle, right? So then when you go close there, then this is gonna be the spot usually. So when you are palpating your patient with this strain, you're gonna try to feel the all muscles anyway, right? So then you're gonna find the spot where they'll feel the pain, mostly like here. So then you may need to perform some like a friction or anything. But again, like it takes a long time to do the friction. So when you go nearby where your patient like tendon is, so then you're gonna find the adhesions, right? So try to loosen up those ones, right? That's the spot. How about the